Hello everyone. Welcome to next episode of Dental Digest with the Study Boards. This is Dr. Trehan and today we are going to discuss our next topic in oral pathology odontogenic cyst series, specifically lateral periodontal cyst. Now in this video we will cover its origin, clinical features, radiographic and histopathological features as well as treatment and differential diagnosis. Let's look into the origin and etiology of these cysts. So LPCs are developmental in nature. They arise from dental lamina remnants found along the side of a tooth's root. And now the location and age group of the occurrence of these cysts is very important. These cysts, they occur in mandibular canine premolar regions in middle-aged adults. Let's talk about the clinical features of LPC. Now do remember that a LPC is always associated with a vital tooth. This is a key distinguishing feature because many other cysts like radicular cysts are associated with non-vital teeth. Then there are some changes you can notice as the cyst progresses in size, like the displacement or mobility of nearby teeth, or even alveolar expansion in buccal or lingual direction. Now on clinical examination, you might feel a firm, immovable gingival mass in the interproximal region, and this mass is not associated with pain, redness or infection, which is going to help you differentiate it from your inflammatory lesions. Now what's interesting is that lateral periodontal cysts are completely asymptomatic. They usually go unnoticed and you will find them accidentally whenever you're taking a routine radiograph. Now let's look into the radiographical features of LPC. So LPCs, they appear as well-defined round or oval-shaped radiolucencies. They are most often located lateral to the root of a vital tooth, particularly in the mandibular premolar canine region. Now the boundaries of these cysts are usually sharp and well circumscribed, making them easier to differentiate it from more aggressive or inflammatory lesions. They are generally small in size, often less than 1 centimeters. And our interesting variant of LPC is going to be botryoid odontogenic cyst. This is an exam question. Now remember, BOC, it shares same location and same origin. But there is one thing which is different from LPC, which is its radiographical appearance. Now instead of the usual unilocular radiolucency of LPC, the botryoid variant represents as a multilocular or multicystic radiolucency, and this gives it a characteristic grape-like appearance on the radiographs. So LPC is unilocular and botryoid variant is multilocular. Now the histopathology of LPC, it reveals a thin, non-keratinized epithelium, and within this lining we can see focal thickenings which contains clear glycogen-rich cells. Now for your exam perspective, you can safely pick LPC if you're coming across 3 clues. First one is going to be location, which is mandibular premolar canine region. Second one is going to be your cyst associated with that of a vital tooth. And the third one will be the presence of focal thickenings in the epithelial lining. Now let's talk about the complications that can arise with LPCs. Now, although these cysts are usually benign and asymptomatic, but there might be some noticeable changes that you can see as the cyst progresses in size, like the displacement or mobility of nearby teeth, alveolar expansion in buccal or lingual direction, or even bone resorption. Now, the recurrence rate of LPC is very, very low, especially if you're comparing it with that of OKC. But yes, it can happen if any part of the cyst lining is left behind during the removal. Now let's go over the treatment options for lateral periodontal cysts. Now the primary approach is going to be surgical enucleation, where the cyst is carefully removed in its entirety. And to further minimize the risk of recurrence, curettage of the surrounding tissues should be done alongside. Now in most cases, this conservative treatment is sufficient enough. However, when you're dealing with larger or botryoid variant of LPC, you have to go through an extensive surgery. Now let's discuss the differential diagnosis of lateral periodontal cyst. Now these include several other cystic lesions that may overlap in their presentation, like glandular odontogenic cyst, gingival cyst of adult, lateral radicular cyst, and a pseudocyst. So first of all, let's consider the glandular odontogenic cyst. Now GOCs, they have 3 main findings that will help us differentiate it from LPC. So GOCs are going to be multilocular, whereas lateral periodontal cysts are unilocular in nature. Then GOCs, they occur mostly in the anterior mandible, and LPCs, they occur a little bit posterior, closer to your canine premolar area. And then histopathologically, GOCs, they show glandular or duct-like structures that are completely absent in LPCs. Next one to consider is gingival cyst of adult, which is another possibility. Now, this cyst is often referred to as the gingival counterpart of LPC, and it appears as a swelling in the gingiva. Gingival cysts do not have any involvement with that of bone, but as we know that LPC is always going to involve bone. Then we have lateral radicular cyst. Now, this cyst is going to be associated with that of a non-vital tooth, and we know that LPC is associated with a vital tooth. And lastly, we had pseudocyst, which can be present as a radiolucency, but the difference is that it lacks epithelial lining, whereas LPC does have a clear epithelial lining. Rather, LPC also has those focal thickenings that we have talked about. Let's quickly wrap up the key points about lateral periodontal cysts. These are developmental cysts that arise from dental lamina remnants, specifically epithelial rests of seres. Then they are commonly found in the mandibular canine premolar region. Most of these cases are asymptomatic with no pain or tooth displacement, and then radiographically they appear as well-defined round or oval radiolucencies lateral to the root of a vital tooth. Now, treatment involves surgical enucleation with curettage, and finally we discuss the differential diagnosis because it's important to rule out similar lesions like glandular odontogenic cysts, lateral radicular cysts, gingival cyst of adult, and pseudocyst. Thank you so much for watching this episode. If you found this video helpful, give it a thumbs up and subscribe to the channel for more content. Let me know your thoughts or questions in the comments below. I would love to hear back from you. Remember to keep working hard and keep rocking. I'll see you in the next one.